Historic medical debt relief, $30 billion forgiven for 20 million Americans. Introduction, Unprecedented Debt Forgiveness. A non-profit organization is making headlines for executing the largest medical debt relief effort in U.S. history. Undue medical debt has acquired and eliminated $30 billion in unpaid medical bills, providing financial relief to 20 million Americans. Yet, as transformative as this initiative is, experts warn that it barely begins to address the systemic crisis of healthcare financing in the United States. How the relief was structured. The debt portfolio was acquired from Pendrick Capital Partners for just $36 million, less than 0.2% of the face value of the debt. Pendrick, a debt collection agency preparing to shut down, either sold or donated the accounts. Approximately half of the forgiven debts are over 7 years old, with most recipients located in Texas and Florida. The average amount of debt relief per individual is around $1,100. Undue medical debt is funding this effort through a combination of charitable donations and public funds. An additional $40 million will be used for processing the accounts and notifying recipients of their newly forgiven debts. However, despite the scale of the effort, it impacts only a small fraction of the estimated 100 million Americans burdened by medical debt. Eligibility and qualifications. To qualify for this relief, individuals must meet one of two conditions: their income must fall below 4 times the federal poverty level, or their medical debt must exceed 5% of their annual income. These criteria ensure the assistance reaches those most in need. The bigger picture: debt relief amidst a broken system. While this initiative delivers immediate relief, it does not resolve the root causes of America's healthcare affordability crisis. In the past year alone, Americans borrowed approximately $74 billion to cover healthcare costs. This suggests that medical debt is accumulating at more than twice the pace that even record-breaking relief efforts can erase. Undue medical debt operates by acquiring unpaid medical bills, often for pennies on the dollar, and then forgiving them. The organization also partners directly with hospitals to intercept and eliminate patient debt before it reaches third-party collections. Recently, the nonprofit has worked with local and state governments to implement community-wide debt relief programs. Expert opinions: symptom relief, not a cure. Despite the benefits to individuals, many policy experts caution that the program is a stopgap measure. Allison Sesso, CEO of Undue Medical Debt, remarked, "We don't think that the way we finance healthcare is sustainable. Medical debt has unreasonable expectations. The people who owe the debts can't pay." Elizabeth Benjamin, Vice President at the Community Service Society of New York, echoed this concern, saying, "The approach is just treating the symptoms and not the disease." Experts argue that the fact medical debt can be purchased for a fraction of its value reveals systemic problems in healthcare pricing, insurance design, and debt collection practices. The policy landscape, a patchwork of regulation. Political tensions have influenced medical debt policy in recent years. The Trump administration rolled back regulations designed to prevent medical debt from appearing on credit reports. Current efforts by some lawmakers aim to make these rollbacks permanent. Meanwhile, several states have introduced their own protective measures, creating a fragmented regulatory environment. These inconsistencies reflect a need for comprehensive, nationwide reforms that address the root causes of medical debt: high healthcare costs, inadequate insurance coverage, and a lack of transparent billing practices. Conclusion: life-changing for some, insufficient for many. For the 20 million Americans who will benefit from this initiative, the impact is significant: reduced financial stress, potential improvements in credit scores, and increased economic mobility. However, the broader structural challenges of the U.S. healthcare system remain. Without systemic reform, medical debt will continue to accumulate, undermining the financial well-being of countless families. Undue medical debt's historic relief effort is a beacon of hope, but also a reminder of the urgent need for long-term policy solutions.